Hello and welcome to the recording of Chapter 9 about epidemiology. Like the word, it's long and complicated, but the topic isn't. And some of the words, though, and some of the content in the chapter, I think is probably a little tricky and maybe over what you need to know. So I'll let you kind of clue in on what I think is the most important and what is probably less important for you at your level. If you do become an infectious disease nurse, you would need to have additional training, but I think a general knowledge of epidemiology is very helpful for any nurse, no matter what their role. So today I'm going to talk about public health science and epidemiology, including factors that contribute to health and disease, the development of health promotion and disease prevention. So you're going to hear that primary, secondary, tertiary stuff again. It's going to keep on coming again and again in public health and community health. Detection and characteristic of emerging infectious agents, the evaluation of health services and policies, and the practice of nursing and community health. So some definitions, and you do not need to know all of the definitions. I think though it's good to have a general idea of what epidemiology is, and that's the study of the distribution and factors that determine health-related states or events in a population. And the use of this information then is to help control health problems, or at least predict what might be coming up. You'll hear people talk about descriptive epidemiology. It's a form of epidemiology that describes a disease in terms of the person, place, or time. And for example, it might, I was reading an article this morning about how salmonella has been a problem for people, particularly children, who get little chickies at Easter time, because the eggs can have salmonella, and so can chickens, I guess their feet, because, not a big surprise, they pretty much have salmonella in their body, and then they poop and they step in it, and when kids touch them, they can get it on their hands, and kids are real likely to put things in their mouth, and if they don't wash their hands maybe before they eat a sandwich or something like that, they could get infected. So that would be a descriptive epidemiology. They looked at the people, the place, the time, how this all happened. And here people talk, and I would know that definition. Analytical epidemiology I don't think is quite as important to know. There won't be any test questions on it, but it is the disease, and it deals with kind of etiology, so the origins or cause of the disease, and it deals with determinants of health and disease. And so how does it occur? Why do some people get affected more than others? And that somewhat relates to the chickies and the kids thing. They're looking at it, but not looking at this article I read was about specific. There's one egg producer that's been mailing them out that seems to be particularly likely to send eggs that have salmonella that get caught. Five they're mentioning in general send out most eggs, and people can get salmonella infections from pretty much any chicken, is my understanding, but this one group is more likely to have chickens with salmonella. So that's kind of looking at specifics is more descriptive. The general, how does it happen, is more analytical epidemiology. In terms of what people do, define, what do they want to look at? Do they want to look at injuries, incidents, wellness, disease, like looking at heart attacks, or looking at likelihood of breaking one's leg? So what is the thing that is the key? And then description of who, the where, and the when of the disease and the or the event or injury. And then they want to look for some factors to explain the patterns or risk. What are the influences? If the person is a skier, are they more likely to break their leg? Yeah, probably. If they work at a farm, might they be more likely to get a disease from a chicken? Maybe. Lots and lots of backyard chickens these days, and so we're finding it in the city in small homes too. So it's changing in terms of the epidemiology of infection when it comes to salmonella in chickens. So as you probably figured out, the purpose of epidemiology is to study the population in terms of what is the health, what are the determinants of health and disease in the community, and then to investigate and evaluate the interventions to prevent disease and maintain health. So those are the three main purposes. There is a variety of history information listed in your book. You do not need to know this. I mean, it's kind of interesting to think about a world before Louis Pasteur. who didn't know about germs and didn't know how people got sick in terms of you touch something and it gets in you and you get sick. They didn't have that idea. There was lots of other ideas, but it wasn't until really the 19th century that that kind of started to get some traction, shall we say. People who have been involved, Lister, he developed antiseptic surgeries, which really helped out in terms of mortality rates improving. John Snow was the father of epidemiology, looked at cholera, not a name you need to know. Florence Nightingale also had some epidemiology thoughts in terms of the environment related to the Crimean War. 20th century things have continued. There's a lot more information about molecular techniques, diseases, genetics, all that has really made a difference. And a new one, bioterrorism, has added into our list of epidemiology things. So how nurses use epidemiology, we look at the health and disease and causation, investigate how to prevent and treat illnesses, and nurses can be epidemiologists. Oftentimes epidemiologists are physicians, but it can be a nurse, particularly in a hospital. And the nurse might do surveillance and monitoring of disease trends and looks for problems. And I was in a neonatal and clinical nurse specialist in a neonatal floor. We had some really weird infections, and the epidemiology nurse looked at where they were happening, thinking, you know, could it be coming from the air vents? So we looked at where the children were placed in terms of the crib and what was going on with them and what nurses took care of them. Was there a particular nurse who might have been infecting them? And is there another treatment that they were all having, maybe some IV solution? And looking at that, and that's a common thing, looking at a particular disease and what's going on with it. Basic concepts, there's a proportion. Not everyone gets sick. What number of people get sick would be the proportion. They are like, once again I said, formulas in the books, you do not need to know the formulas. You hear about rate and risk, the incident rate, how often does it happen, and the proportion of people. An epidemic is when a large group of people get sick. Prevalence proportion, how many people are getting infected or getting the disease. Attack rate, how strong is that? Case fatality rate, so how many people die, and then proportionate mortality rate, so how many people of the total actually die. And take a look at those definitions. I read in the first part of your book, and oh my gosh, I did not really like in chapter 9 the definitions. They were a little bit hard to understand, but reading in the text made it a little bit simpler. You may, when I give out the test kind of study guide, if some of these words don't make sense from what you're reading, I would look it up on the internet to find a little bit more. And also some of the things like the perfect neighborhood and some of these other ones you're going to be doing will help with this too. Under Epidemiology Triangle, this is important. I would know this term. There is things like agent, host, and environment. You want to, when you're looking as a nurse or as anyone about how a disease happens, you're going to look at, so what's making them sick, who's getting sick, and what's the environment around. For example, in terms of the chickens have salmonella, so they're in the way the host. The agent is the salmonella, and the environment is either someone's background or possibly a farm or somewhere at a feed store or wherever little people get chickens. So that would be the triangle. And it's important to think about all the factors. You can have healthier chickens that have less disease, or you might just make sure that people keep their hands clean, or don't let kids touch chickens. And the American Pediatric Association suggests that children under the age of 6 do not handle chickens because of this. So just something to think about when you think about disease and how we might interact and make a difference. The web of causality is a term which you might hear. It's recognizing the complex interrelation of many factors interacting, sometimes in subtle ways. Relationships are sometimes mutual with lines of causality going in both directions. So, in other words, having someone get a disease is not just a simple, you got it, you don't. There's a lot of things that involved For example, with the chickens, the immune system and how a person's immune system reacts. That's why one of the problems with little kids, besides them putting stuff in their mouth, they also tend to have an immune system that's maybe not quite as effective as an adult's. But older adults too, or someone who might be immune suppressed, maybe with HIV or some sort of treatment like prednisone, would also have a greater risk of cause. And so we need to look at all of those factors. Once again, make sure you know the level of prevention. Primary intervention seeks to promote health and prevent occurrence of a disease, injury, or disability. So that might be education on lifestyle, or how to, like, for example, STDs, how to avoid an STD would definitely be a primary. A secondary then is to directly influence the disease, so might be catching it early and getting treatment. And then tertiary is to prevent long-term problems. So, for example, it might be doing rehab, someone with a stroke, but it might be taking some medications to help prevent further disease problems. Someone who might have osteoporosis may be encouraged to drink additional amounts of milk so that it doesn't get worse, or take some medications in order to help that problem. So make sure you know those terms. So screening. Screening is a general term which is used to basically mean we're taking a look to see who's got it. And sometimes people might show positive, but they actually do not have the disease, or might show negative and they do have the disease. So you'll hear people talking about tests that are not as effective. And so we want to take a look. You know, are our tests being specific and giving us good information? Many people, men over the age of 50, have been having what's called a PSA. It's a prostate detection test to see if people might have prostate cancer. And they found that there's a lot of false positives, a lot of people who seem from the test to be positive to have cancer, and they actually do not. So there's some strong recommendations now to really think about whether men should have it, because it's very concerning if you have a high level PSA. People start to worry, do I have cancer? And some people have even been treated, and in actuality they may not. They might just have an enlarged prostate or something else that's going on. So you want to look at reliability, how precise, how consistent that is, and validity too. Is it sensitive? Is it telling us what we want about the disease that we want? And is it predicting? So the people who really have it, do they have the disease? Or don't they have the disease? These are some things that we want to think about with screening, because people don't trust healthcare because they've been told, oh, you have this disease, oh no, you don't have the disease. They're going to really worry about screening and tell their friends too, and not have any screening anymore. So those things we have to consider. Sources of data. Now looking at, so you are an epidemiologist, or you're looking at epidemiology, you can do a variety of things. Some routine data collections includes looking at census data, who lives where, what's their ethnicity, that kind of thing, what their age is, vital records, birth records, surveillance data, looking at many, across the country there are specific diseases that health agencies, doctors are required to report. So that's some information that you can get, oftentimes collected by the CDC, but also local governments will have that data, at least for the local sources. Data can also be looked at through medical records, and then you can also look specifically at epidemiological studies, the research that's been done. Here people talk about comparison groups, deciding whether disease rate is, the rate of disease is a result of a suspected risk factor. Compare exposed groups to those who weren't exposed. So, you might say, is this lung disease related to an environmental stimulus? Some people say, for example, who live in the desert. A lot of people who live in the desert on those dusty days have a lot of problems. So you can compare like ER visit rates of people who live in the desert, and particularly on a windy day, to those who may not be in the desert on the windy day. or even with comparison of windy days within the desert and non-windy days. So you can take a look at comparison groups and see, is there a difference in their disease rate and susceptibility. Here, once again, descriptive epidemiology kind of takes a picture looking at people's race, sex, age, occupation, income, marital status, examines geographical patterns. For example, people who live up north in the United States are much more likely to have MS, multiple sclerosis, than people who live in south. And why does that happen? What is it about living up north versus living south that makes a difference? Could it be vitamin D? Could it be something else? So that's real helpful to look at those geographical patterns. It helps not only identify who's at risk, but also then maybe see what is the cause then. In terms of time, are there specific times when things are more likely to have fluctuations calendar-wise? For example, in the winter time, people, particularly up north, are much more likely to have seasonal affective disorder, to become depressed. So it's just something that happens, and an epidemiological nurse would need to be aware of. Or there are other things that are happening that not sure, but they seem to be clustered. Those are some ways of looking at epidemiology and disease. Once again, analytical epidemiology, I would know the word cross-sectional studies and cohort studies. Cohort studies is when you look at, once again, two different groups of people to see if there's a difference. And that could be retrospective. For example, maybe you want to compare people's breast cancer risks, so women's breast cancer risks, from a group that worked in an environment that had a lot of chemicals versus those that didn't. You could look back at the records of maybe take two different factories, one that had a lot of chemicals, one that didn't. Look back, how many people left work because of cancer. Prospective studies, usually you get a group of people and you say, okay, from now on we're going to find these people and follow them and see what happens with their disease. There's been some nursing studies that have gone on for years that have been very, very helpful in terms of understanding disease, because it's great with nursing, with the registered nurse, to they can track us down, and so they can find where we are and what our health problems are, and that can look in the future. Cross-sectional studies, kind of looking at one time and what's going on in terms of prevalence. There are some experimental studies. You'll hear about randomized groups and blind treatments. When you get into your research class, you'll hear a little bit more about that. The randomized groups means you might have a group of people you want to study. Maybe one group's going to have some sort of medicine or treatment, one group's not, and through random selection, then determining, okay, this is the treatment group, this is the not treatment group. Blinding the treatment means that the people who are involved in the treatments and the procedures and the research are not sure who's who. So one might get a pill that has medicine in it, and one might have placebo. And that would be a blinded treatment. That way we know at the end that the actual result was due to the medication and not people's expectations. Causality. What are the statistical associations between things? You hear people talk about bias. Now, usually when I think of bias, I think of more personal bias, like, oh, that person doesn't like that person because they don't have, or something, or they're like something. Maybe they don't like tall people, and that person's particularly tall. But when we're talking about causality, talking about more of classification and what is it that might influence the study of causality, and are the confounding factors. Confounding means confusing, ones that might make people unsure of what the results are. And then you might think about, for example, let's think of a disease. There's an association between people's height and large feet. Well, large feet don't cause people to be high, and height doesn't cause large feet per se. But if you looked at it, one could look statistically and say, hey, there is an association between, is there a cause and effect? Well, not really. They're associated. So one really needs to pull apart those kind of data bits and find out, what's really going on, because sometimes things can be kind of confusing. And so assessing causality, is there really a relationship that is related to cause, or just is there just relationship because things are just there? So application of epidemiology and community-oriented nursing, lots and lots of different roles. Nurse epidemiologists, like I said, work in hospital or in the community setting. School nurses definitely look at that. I have some friends who are school nurses, and they're trying to find out, where do those head lice come from, and how do we get those kids, and what do we do about those. Communicable disease nurse may also work in a public agency, possibly at a hospital, usually not, looking at diseases maybe like TB. Environmental risk communicators might help with education and of community risks, environmental risks, and then also identifying them. Like I said, the hospital infectious control nurse or disease nurse is also another role that a nurse epidemiologist could do. A nurse epidemiologist might also work like with Center for Disease Control or a larger state organization too. In terms of what a nurse might do, they might also be one who looks at charts and records and finds information, and maybe not quite fit into any of the specific roles. So that is the information about epidemiology. I hope this was helpful, and feel free to ask me questions if you don't understand things, and I'll look forward to talking with you. Bye now.